but you're not actually healing from anything. So these things are going to keep coming up, and you're going to keep using substances more and more to kind of treat the mental health symptoms that come with trauma. And then as the addiction's getting worse, you're probably going to use more, and then you're going to just be numbing things until the point where it kind of explodes eventually. It's like a pressure cooker. The more pressure you put, eventually it's all going to come collapsing down.
Welcome back to Heal Your Roots podcast. In today's episode, we have Laura Schneider discussing the cyclical nature between trauma and substance use disorder. Laura shares great insight and tips on how to work through this holiday season. If you or a family member you know may be struggling with substance use disorder, you're going to want to tune in. Thanks so much. So I'm so excited for today's episode, Laura. Thank you so much for joining us today. We can kind of jump right in. Can you share a little bit about kind of how you got into the field and into the world of therapy?
Sure. Thank you for having me. First of all, I'm very excited to be here. I got into what I do now in a very long roundabout way, but I'm very glad I got here. I started when I went to school. I thought about, what do I want to do with my life? So I started taking classes for nursing. And part of that is you take prerequisites, and I started taking psychology classes. And something about learning about how the mind works and how people are was so fascinating to me that I changed my major. I studied psychology. And after I got my bachelor's degree, then came another period of, okay, well, what do I want to do with this degree? How do I want to use this? So I started working with caseworkers. I was a case aide. And in that work, I decided I loved working with people. I loved the challenges that they had and trying to help them as much as I could. So I learned about a master's in social work. And I really liked that degree because it opened a lot of doors. It was very versatile. You could really work with a lot of different populations in different settings, doing different things. And that really intrigued me. So while I was getting that degree, I started really loving the classes where we talked about the therapeutic interventions and how to be a therapist. So that was always my long-term goal. During that time, however, I got very into drug addiction. It started very innocently and eventually spiraled pretty out of control. So my career path kind of took a backseat for a bit. Once I got help, I went to a place where a lot of the therapists were openly in recovery. And I remember sitting there thinking, oh my God, I want to do the same thing. I have this degree already. I have this real world experience. I know what this is like. And so that became my new long-term goal. And then once I started doing that kind of work, working with alcoholics and addicts and providing therapy for them, I realized that this was always what I was meant to do. It was the purpose that I was given, and I feel so fulfilled. It's a very challenging job, but it's one that I find so rewarding. I absolutely love it. Even on the really hard days where so many things are going wrong, I still very much know that this was my calling and why I was put here.
Thank you for sharing that. I appreciate that. I know it's not easy for us to always kind of share vulnerable moments of our own personal life, especially as a therapist. And I think that a lot of our own personal experiences, whether it's within our own life or family or the things that we've gone through, kind of inform why we choose particular specialties or who we want to work with. And I'm curious of how that, I'm sure, really helps your clients feel like they can relate to you, knowing that that's something that you've gone through as well and here to help them move through it.
I think it does. A lot of the clients I work with do appreciate the honesty. I don't share a lot of details about it, but I think just knowing that I come from a similar background really does help. I know for myself it helped because I did try treatment a couple of times before my last attempt, and I didn't know for sure if any of the therapists were in recovery or not. And I know in the field of social work, it really shouldn't matter, right? We're taught not to share too much about ourselves because it's not about us, it's about the people we work with. I just feel that this is a very unique population, and I think that having that degree of familiarity and understanding between us really helps the therapeutic relationship. And I find that people kind of might feel a little bit more okay, this is a therapist in front of me who I hopefully respect, and I value their opinion, and they're also in recovery. So they got it. Maybe I can get it too. Or like they're not just telling me something that they read in a textbook. They're kind of giving me real advice. And I find that it really helps, especially um, in our, our people are very resistant to change at the beginning. So I think having good role models helps.
Absolutely. And so, what kind of different settings have you worked in terms of with clients, like inpatient or outpatient? What that's been like for you in your experience?
For substance use disorder, I've worked in outpatient. I also have a background in mental health therapy, just strictly mental health, where I did outpatient services as well. I've worked in a group home for developmentally disabled children. I've worked with CPS, not going to family court. So I've been in a lot of different outpatient settings.
And so, when you are at your current placement right now at Valley Springs Recovery, is that an outpatient
Yes,
facility?
that's an outpatient. Hmm.
Okay. And so, the clients you're seeing, are they actively in addiction or they're through the recovery process?
We're getting them in the early stages. So some people come in and it's their first time and it's the early days and they don't know what to expect. We have
Hmm.
some people who this is not their first rodeo, so they kind of have an idea of how recovery kind of works. So they come in with some background in trying to get help. I find we have people that come in the very beginnings of recovery, so they've never been to treatment before. They don't really know what to expect. We have some people that this is not their first go around, so they do have some background in the treatment process. Some people that come for, to make their families happy. Some people that really want it for themselves. And then during that process, some people, have slips or relapses. A good portion of them do remain in treatment or try to get re-engaged and get back on track for the most part, which is a great thing. Very rarely do they kind of just disappear and never come back. But yeah, those are probably most of the people we see.
Hmm. Well, that's great they don't disappear. That means
Yeah,
they're
no, yes.
committed to treatment to some degree, even if they're not ready at that particular stage. But, because I know there's different
Yeah.
seasons of this process. So knowing
Yeah.
that the place you're at Valley Springs Recovery, it sounds like depending on where you're at in your journey, this is a good spot for them to come to get treatment.
I agree. And I think the main feedback I hear from a lot of the clients is that they feel cared for. They feel like we actually do care about them and want them to do well. And that's really the best thing to hear. I want people to feel heard and seen and valued.
Absolutely. And so I know that you specialize in addiction treatment and substance use. I know that you also work with trauma, and I know that there's a really large overlap and kind of like this cyclical relationship between trauma or PTSD and substance use disorder. Can you speak a little bit more on that or what you've seen in your experience or your knowledge around that?
Yeah. We actually talked about this yesterday in group. A lot of the people that I see, I love getting the trauma people. If I know they have trauma, I do try to see them because that is um, one of my passions is working with trauma and PTSD. One of the things that we learn in the process is some people will come in with trauma before their addiction starts, and then some people will have trauma kind of in adulthood. But one of the things we try to put together are like the pieces of, okay, what is this trauma? What is the impact it's having on your life? Is it a story where the pain is so much that you did different things to cope with it in a way, numb it or try to push it aside and pretend like it's not there? Eventually, drugs and alcohol become a great way to do that because it kind of turns your mind off a little bit. But you're not actually healing from anything. So these things are going to keep coming up and you're going to keep using substances more and more to kind of treat the mental health symptoms that come with trauma. And then as the addiction's getting worse, you're probably going to use more and then you're going to just be numbing things until the point where it kind of explodes eventually. It's like a pressure cooker. The more pressure you put, eventually
Yeah.
it's all gonna come collapsing down.
Yeah, and it's interesting because you're saying that sometimes people come in with trauma and they haven't even really started using substances, or it could be vice versa, right? Like they may have already started using substances for whatever reason, and maybe there's, they had an accident or something else that's been going on in their life.
Mm-hmm.
And then through that process, they may find themselves in kind of traumatic or dangerous situations that exacerbates that and those symptoms. And it kind of just goes back and forth.
Yeah, it's a snowball effect. One of the young men was talking yesterday about how he, I think it's like 10 years or so, he hasn't processed this really traumatic thing that happened where he found a friend that passed away, and it was after a night of them partying. So he has been carrying around for 10 years who knows what. He hasn't even started unpacking it, like the guilt, the shame, the sadness, the anger. There's all these things that he's just been numbing, and the stuff is still going to be there underneath, but we're not actually healing and getting better.
Yeah, wow. And I can imagine a lot of people who have had childhood trauma, right? Like years and years or decades of not really wanting to go there or think about that, and numbing, or it's self-medicating, right? I mean, it is a coping
Yeah,
mechanism. It's maladaptive. It's not the best one, but it's, something that they found to help them move through life, to not have to deal with those, whether it's painful memories or like the dysregulation in their body. Yeah, that's a lot. And it's
yeah,
heavy work for you to be in every day as well. So I commend you for being in that specialty and helping people in that circumstance.
yeah. Thank you. I think also trying to identify healthy coping skills can be a challenge too, because sometimes people don't even know really who they are, and depending on what the trauma is. I really love working, especially, not that I don't like working with men, but I like working with women who have trauma, because a lot of times what I hear from them is this great sense of not really knowing who they are and having this narrative in their head that doesn't really come from them,
Mhm.
that it's very, very low self-esteem and no confidence, and very, very degrading to themselves, and trying to work on building up that piece of self-love and confidence, and kind of rewriting the narrative that they've had running in their heads for years.
Yeah. And so, how do you kind of approach that if someone's coming in with addiction or substance use and they have a history of trauma? Like, do you tackle both at the same time? Do you kind of take time to separate between the two? What's kind of like the course of action? Obviously, it's different for every person, but like generally your approach to that.
It's kind of like what you said. It depends on what symptoms are presenting, who the person is, what really needs to be tackled. The hope is that by the time I see them, they're relatively stable. They haven't had substances in their system for a while, so they're as close to baseline as I can get them. If they're gonna be there for a short amount of time, I don't go deep diving into the trauma, but we kind of talk a little bit about maybe putting the pieces together of, okay, we have this traumatic experience you had. How does that paint your view of the world? How is that kind of shown you how to react to people? How can we work on that so it's a more healthy way? If you're someone that gets, like, do you know your trauma triggers? Do you know when you're going to be more irritable, more susceptible to like panicking,
Mhm.
depending on what you have? And we kind of work on how do we manage the symptoms. If they're going to be there a little bit longer, and I know it would be safe to do so, we do try to dive deeper and to kind of talk about the trauma more deeply and really process that over time. It really depends. If someone's coming for maybe a month, I'm not going to deep dive into a lot of heavy stuff,
Sure.
but I will try to set them up for like a longer term plan. Luckily, most of the people I do work with stay for a good amount of time, so we're able to do both.
Okay. So that's great. I'm glad that you mentioned that if they're not there for a long time, you're not just going like straight to
Oh
like
no, that would
some
be
of,
terrible.
yeah, like the worst thing that ever happened. Okay, in a couple weeks we're ending. So see you later. I just opened
Yeah,
up this wound for you that's like bleeding
exactly.
out, which is the reason that you've been numbing or avoiding, and now you have nothing to help cope with it or move through that. So more about like
Yeah,
symptom reduction, and it sounds like a lot of self-awareness, right? Like making sure they can recognize when they're experiencing these symptoms as well.
yeah. Because that's also the main takeaway I get from a lot of when I'm listening to what people are talking about. Um, it's kind of awesome to watch people discover their own, um, the ways that they react to things, and how they didn't realize in that moment, oh, I didn't realize that something like that is why I feel this way, which makes me behave this way. And it's really amazing to watch people put those pieces together for themselves, and then hopefully find better ways to cope with things.
So I'm sure that's one of the most rewarding parts, right? Is like having all the
It
pieces, or
is.
like watching the light bulb go off, like, oh, I get it now, or
Mm-hmm.
recognizing that that experience was traumatic. Because I don't
Yeah.
necessarily specialize in trauma, but in therapy, a lot of our clients are coming to us with some level of traumatic backgrounds, relationships, instances that they bring up. And sometimes they don't even recognize that what they went through was traumatic because it doesn't seem that bad, or doesn't seem
Yeah.
like a big deal, or people around them had it worse. So I'm curious what that's like if you've had clients who kind of minimize or downplay or don't even recognize that the things they've been through are traumatic and impacting them now.
So I do have. I'm thinking of one person in particular that told me some stories, and in my head, it sounded very traumatic. They didn't. It was, very. I don't know if they were minimizing it or if they just didn't experience it as traumatic, but it did sound pretty traumatic. I always include it in my notes, and I always put it down in like my trauma history just in case it comes up again, and
Mm.
then maybe lightly touch on like trying to pull similarities. Oh well, if you're kind of talking about these feelings of underlying um, self doubt, or thinking that people don't like you, or this, whatever they're bringing to me, could that relate to the feeling you might have had experiencing this? And trying to help them see, I'm never going to tell someone else's story for them. So if they
Mm-hmm.
don't think it's traumatic, then I'm not going to tell them it's trauma. But I just want to kind of, I always tell them, like, this is just food for thought. And I just kind of give them little, little things to think about. A lot of my homework for people is just think about it. I just want you to think about these things, reflect, journal.
See where the connection might be.
Yeah.
Mhm. And so I know before, when it was just the two of us talking, that you mentioned doing a lot of like inner child work. Can you
Hmm.
share a little bit about that as well?
I find inner child work to be childhood work to be very fascinating. I think it's a hard one to get people on board with sometimes, because I get it. It sounds kind of like odd, like you're parenting your inner child, and to
Mm-hmm.
do that, sometimes I also, okay. So let me tell a story. I love doing art therapy. It's one of my favorite things to do. But a lot of they're all adults, but they get a little resistant to art therapy. They're like, "Why am I coloring? I should not." I'm like, "We can talk about heavy stuff again, but this is just to have fun." And there's a little piece of the kid inside that just wants to play and have fun. And a lot of people might not have had that, might not have had the chance to just have fun. And you get to care for the little version of yourself that maybe didn't get that care, and heal that. I always tell my people, think of, so I would say, for instance, think of little Kira. Think of little Kira who just wanted a hug, and she just wanted a doll, and like she never got that. Like, get her the damn doll. Like, let's take her outside and touch some grass, and paint or something, and care for her. There's something very healing about being able to care for like this metaphorical smaller version of yourself.
I love that. And it's interesting because the work you do is, I'm sure, really heavy. And, therapy in general can be really heavy. And I think that clients forget that a big part, and even us sometimes, a big part of healing is experiencing joy, right? Like, it's not just about talking about these really, whether it's traumatic or serious or vulnerable things. Yes, it's that. And it's, okay, now how can I make more space in my life to feel joy and happiness and just be present and do these activities that have no function for productivity or anything like that, but just for me to just live and be like, have fun, like you're saying, is just enjoy life for a moment.
Yeah, those are actually the groups that I love to do. I almost always want to do those groups. I mean, obviously, but I think, first of all, sobriety wouldn't be no one would keep doing it if there was no fun or joy ever, right? If it was a drag every
Mm-hmm.
day for the rest of your life, why would anyone ever stay the course? So it's kind of showing everyone, hey, we're still allowed to laugh and have fun and be silly and goof off. And there's also a dynamic in the group where that brings up group cohesion. If you're all making jokes and laughing and having a fun time together, those are the memories that I remember from my own group therapy years ago. I remember the fun groups where we made like gingerbread houses for Christmas and we were all just joking around and it was fun. I not that I didn't get anything out of the heavier groups, but the fun groups is where, I kind of what you're saying. I remember there's joy. I'm allowed to have joy and I can have joy without anything in my body that shouldn't be there. Like that's pretty cool. That's
Mm.
pretty nice.
Yeah. And I think that's a big part of helping with trauma too, right? Especially since it's so in our body and our nervous system is dysregulated and we're on edge and there
Mm-hmm.
could be panic, right? Like our amygdala is being fired all the time. So having joy is like telling your body, hey, I'm safe enough to not be vigilant. I'm safe enough to just focus and be present and enjoy the company of other people around me and laugh. And the more
Mm-hmm.
space we create for that, like stillness, right? It also helps our body kind of heal as well outside of the narrative and just like internally, somatically as well.
Absolutely. And I think it's a win-win because um so if I picked up the guitar when I got sober and I was dealing with my own mental health stuff
Mm-hmm.
and I found it to be so rewarding. And I'm not saying everyone's got to pick up a guitar and learn, how to play music, but there's something out there that you can do that's really gonna like help you get these things out of you. So for music, if I'm sad, I like to play sad music and I like to write a lot of stuff that's going on in my mind, get it out of my head. And it's a healing thing. It helps me process what I need to. And I think there's a lot of different mechanisms to do that might be a little outside the box. I tell people play to your strengths. I know that I like art and I like music. So I tried to do something in that. If you've always been interested in knitting, try it and work towards it because everything's new and frustrating at first when you don't know how to do it,
Mm-hmm.
but the more you do it, the more you learn, the prouder you feel, the more you want to do it and you feel accomplished, and it's very empowering. If you're someone that likes to run, make it a goal to do like a half marathon and take pride in each day trying your best and just working a little harder to
Mm-hmm.
get to your goal, and then you're going to feel so many good things.
So it sounds like kind of redirecting your energy and your thoughts on something healthier, right? Like that's for you,
Yeah.
that brings joy, that is a learning curve, right? It's not about being really good at
Mm-hmm.
it, but it's you gain confidence throughout that process and sticking with something so that you
Yeah.
feel better about yourself.
Yeah, because in substance use disorder, the number one trigger I hear is boredom. When people don't
Mm.
have things to do, they get bored and then they don't. They're just like, whatever, I'm gonna go do what I got to do. So I tell people you're gonna have a lot of time on your hands now that you're not, going to the liquor store, going to your drug dealer, worrying about this or feeling sick. You're gonna have a lot more free time. Let's make some good use out of it and find something that you like to do, so that downtime doesn't feel boring. I mean, as humans, a lot of people have to learn that it's okay to just exist. Our bodies and our minds
Mm-hmm.
need to rest, and it's okay. You don't have to be engaged in something all day, every day, but we can't be not doing anything all day, every day. We got to find some things to do so that that time feels fulfilling. And instead of calling it boring time, it's more like, this is my peace. This is my peaceful time.
Mm. It's interesting that boredom is a trigger. I wouldn't have necessarily thought about that, but I can think about,
Yeah.
at least for me, like I have ADHD, and like when I'm bored, sometimes it can feel or is interpreted as me being sad. And so I'm
Hmm.
curious if there's kind of that connection too of when you're bored, there's nothing to do, you feel like you're not being fulfilled, and so it kind of feels like sadness, or if that's just like a personal experience and that's not something that maybe other people kind of link
It
together
could
with
be.
boredom.
Well, because when I think of boredom, a lot of people also talk about the feeling of loneliness too. And I think
Mm,
that can feel sad as well. And this is more of that kind of CBT technique, is like, what words are we using, right? Sometimes we are going to be a little bored. It's okay to be bored. You're not going to always be fulfilled every single second of the day. but it's about being able to kind of sit in that, tolerate it, and then maybe change how we view it. So for me, if I'm having that boring time, or what other people might look at as boring, I find it very peaceful. I find it, we're also breaking this cycle of chaos. So a lot of people in addiction and in trauma get very used to chaos. And we logically know that the chaos is not good for us. We're not happy in that chaos, but it's comfortable. When you've lived in it for so long, it feels familiar. So you might keep trying to chase that chaos in some way. So I think it's about accepting that you don't have to live in chaos, and that's a good thing. You're allowed to have peace. And instead of calling it boredom, let's call it downtime and the serenity that you've been looking for, because you deserve to not live in chaos.
That's so true. Whatever's familiar is comfortable, even if it's not something that's healthy or that we enjoy. It's just we know what to expect. We know what to do with it. And change is hard, right? And anytime we change, there's like a grieving process. Even if we're changing for the better, we're still grieving something that we're leaving behind or losing that served a function for some period of time for us.
Yeah. In our field, we say like drugs and alcohol, that's not the problem, that's the solution. But what are we solving? What's the question where, like, what are we using it for? It's serving a purpose. We wouldn't do it if it didn't serve a purpose.
So I know that you, coming up in the next year or sometime soon, wanted to become EMDR certified. For the listeners who don't know what that is, can you share a little bit of like what that approach is and what made you want to start learning and going into that direction?
Yeah, sure. A lot of clients bring it up to me. It's something I've read about, heard about, done like short trainings on, but it stands for eye movement desensitization and reprocessing. And it's basically like the last two words, desensitization and reprocessing. You know, trauma has an impact on how we experience the world, right? So when we're triggered in those moments, it causes us great distress, right? And that can impact how we're relating to other people, how we're reacting in situations, and it's not always the best, healthiest way, and it's very uncomfortable for us. So this is a technique that kind of uses eye movements, similar to REM sleep, I believe, to minimize some of how we experience that distress when we recall certain traumatic events, so that these moments aren't as intense when we experience them.
And is that something that I know you said you did like a couple of short trainings on? Is there anything that like when you were learning about that you're like, oh, I definitely want to do this, or that made you want to pull towards it? Or is it just that working with trauma, it's kind of like the natural next step?
I remember being very curious about it when I first learned about it. This was probably like 10 years ago, like long time ago when I did it. At that time, I was working with children who survived sex abuse. So we didn't put it, I was still in school, so we didn't, practice it. And I remember learning about it and thinking, that's really interesting. But again, my own journey got very sidetracked, so I didn't really, go back into it. And then as I was working in mental health and working in addiction, it's come up a lot, and a lot of people have had interest in it. I know I've been very curious about it myself. So I thought, if I'm really going to try to specialize more in trauma, I should be really informed in a pretty successful and needed technique.
Yeah, absolutely. And I know that it's like pretty evidence-based. Like there's a lot of research studies that show that it decreases the symptoms of PTSD or trauma like significantly, and your experience of it. I mean, I've had it done for me personally. I haven't had like the full kind of course of it, but it's pretty intense. I think you have to like really be ready for that journey and know that like, okay, I'm committed to experiencing this and working through it. And it's like kind of like it gets worse before it gets better, at least from my experience.
Yes. This is where I would be particular about who I implement it with, though, because if, again, I'm not going to open Pandora's box. If someone can only be with me for a month, I would kind of be more open to, I don't like to have a discussion with people at the beginning of really how long treatment's going to be, because I don't know that. I can't answer that for them. And I don't want to give them an arbitrary number, and then they get so focused on that end game that they're not present. So I never really give anything more than like a kind of basic trajectory of how I think it could go with no promises made.
Mm-hmm.
But I think, with depending on who I'm working with, I think I would have to highlight who would benefit from this, who would want to be with me for a while, because I don't want to, like you said, it can be pretty intense and it's going to feel worse before it gets better. So I don't want to just, let's do EMDR and then you're out next week. That's not a good idea. So, I'd have to be very careful, but I think I have enough people that would be with me long enough that it would be beneficial.
Yeah. And can you share a little bit if you know like kind of like the process or what that's like for a client who might be interested in that or is struggling with trauma to think about what they could expect in something like that?
I haven't performed it myself, so I can't speak to like how it might look that way. But from what I
Mm-hmm.
know, the first session or two are very, getting like the background information, getting the history, and then you and the clinician kind of highlight what traumatic memories or what things you want to, what distressing symptoms you're going to be looking at, and you're looking to replace that with a more positive belief in that place. And then over the course of a few sessions, you're going to be really, you got to be ready to recall these events in great detail. And that might bring up a lot of emotions and feelings. And then they do the tapping or the fingers snapping or the clapping to reprocess that in your brain. And so it's going to bring up a lot of stuff. So start small with smaller traumas that aren't as intense, and you do that for a few weeks. It really is going to depend on the person and what traumatic memories
Mm-hmm.
you're bringing up, how intense it is, and then hopefully you're feeling better after a couple months of that.
Yeah.
And then you kind of, I think you'll either pick more stuff to. We're not. I don't think we're ever fully healed, so I think just because life is a growth and change process, I think you can minimize a lot of things, but I think like grief never 100% goes away, but you learn to manage it and live with it. I have
Yeah.
anxiety, and I've just learned to manage and deal with it and find what works. It's never going to go away 100%. Anxiety is a normal thing to happen, right? Grief is a normal
Mm-hmm.
experience. Pain is normal. But I think we don't want it to impact our whole lives where now we're always distressed or always anxious or always this way. But you should feel,
It's not getting rid of.
yeah, we're not getting rid of anything. We're just kind of learning how to live with these things and manage them in a way that's effective and helps.
Yeah. And from my understanding, so I don't know for sure, but from my understanding of EMDR, the way that it works, like in your brain, is pretty fascinating and interesting, especially why they do like the eye movements or the tapping to incorporate with that. Is that, when a person goes through a traumatic experience, everything in your brain and body kind of shuts off that doesn't need to be there to survive in that moment. So, like, your language center is off, your reproductive system, like, everything is kind of off that is not immediately necessary. So, like, the story and narrative of what's happening versus what's really going on is like disconnected, right? And
Yeah.
so then from what I was reading is that EMDR helps you make that connection between the traumatic experience, between the story, communicate that to each other, and desensitize yourself to create this new narrative about the situation or about what you feel or think about it so that it doesn't feel the same way in your body and in your mind,
Mm-hmm.
which is pretty
Yeah.
powerful. Like, whoa, that's crazy.
Yeah. It is fascinating. I wish I was like a neurologist or someone who could understand or anything with the brain that understand how that works. But it's powerful, and it like you said, it's evidence based, so it works for a lot of people.
Yeah. And so I know with the holidays kind of coming up, is this a would you say this is like a natural trigger for some people or some of your clients just being whether it's around family or like memories or in the Northeast of like being in New Jersey, New York, it's cold and there's like, seasonal
Hmm.
depression. Is this a time where you might see more relapse?
Absolutely, this is what I call the danger zone. I feel
Mm,
it's because it's a lot of holidays back to back to back, and that can bring up either painful memories of not having their families around. It can highlight, you have to be around family members that you might not get along with. There's usually alcohol at events around the holidays, So, and like you said, it's cold, it's dreary, it's, you're going to be more prone to that. Oh, it's boring because I can't go outside and it's too cold in the snow. And it just, and seasonal depression where now you're just feeling sadder in general. And it's definitely a danger zone. So we've talked about that a bit over the last week or so. Like what's the safety plan? How do we manage through the holidays in a way where we're going to manage our symptoms well and not go back out and use? Like what are the tools we're going to put in our toolkit for the holidays? And on the flip side, I do have some people that are excited because they're like, oh my God, I'm sober for the first time on Thanksgiving. That's fun. And you're like, okay.
Oh.
Yeah.
And so for the listeners, are there any kind of, I know it's very, specific and customized to the person, but is there any like kind of general tips that you could give people during this time that might be in recovery or struggling to help them move through this holiday season or winter?
Absolutely. There's a few tools that I always recommend for the toolbox, no matter who you are. So that's coming up with a plan, right? And part of the plan are going to consist of different steps. So I always encourage people, if you're going to someone's house and there's going to be alcohol, and there's no way to avoid that, go late, leave early, take care of yourself. Have at least one person, at least one, ideally more, but at least one person who you can confide in that can help you. So if you get there and it's more of a struggle than you thought, have someone that you can pull aside to talk to. Have a safe word that lets them know we got to leave right now because we're in high red alert. Have some people on standby on your phone that you can text or call so you can step out if you're having a craving. So like, hey, you got 15 minutes to just talk me through this and, get through that with them. Bring drinks that you like. If your favorite drink in the whole world is Diet Coke, bring 12 Diet Coke so you know that you have your favorite drink. Always have it, and always have it in your hand because people are a lot less likely to offer you a drink if you're holding a drink in your hand. So I always tell people to do that. And just don't be like, I get it. We all want to be polite and kind. You don't have to worry about what other people think. If you're struggling, don't just sit there because, oh, Nana said, Nana's going to get mad if I leave. No, like if it's between you drinking or Nana getting offended, just, go take care of yourself. Be safe. Your safety is the number one concern. And you don't have to tell anybody why you're not drinking, but have a firm no. No is a complete sentence. And I know that a lot of times families don't take that. They want more information. Come up with whatever you want to say. If you're on antibiotics, say you're on antibiotics. If you're saying, oh, I'm not drinking in November, say that. If you want to tell people you're in recovery, even more power to you. But it's your story. You don't have to tell people unless you're comfortable, but just have a firm no. Don't be like, some people will, because we want to be kind, we care what other people think. A lot of my people I work with are people pleasers, as am I. We feel like we owe people an explanation or something like, we don't. We can just say, no, I'm not doing this. And we can say that in a way where they understand that's like the end of the conversation. Because some people will say, oh, no, not right now, I'm good. Maybe later, maybe next time I see you, just put a firm no on it. You're allowed to have boundaries. You're allowed to stand up for something that you need. You're allowed to express that.
So it sounds like a lot of being assertive, boundaries, having a backup plan, like thinking ahead a little bit and having support around you.
Yeah. And being just very honest, and especially with yourself. Some people think like, this is a test. We're not, this is not a test. These are not like little, you can get through these moments and feel proud of them, but you shouldn't need to like go out and test your sobriety, right? Like, that's why I always say, even if you think you're going to be fine, have a safety plan.
Yeah.
I'd rather you have like 20 different coping skills and never need to use any of them than be stuck and now you don't know what to do.
Sure. Better safe than sorry, always, right? Better to be prepared and not have to do anything, and vice versa.
Exactly. Yeah.
So, Laura, this has been very informative, really great. I really appreciate you coming on. Is there any way for people that are listening that might want to work with you to get in touch with you?
Yeah. So I have an email address, lschneider@valleyspringrc.com.
Thank you so much, Laura. I really appreciate your time and you sharing your insights with us today.
I appreciate it. Thank you for having me. This was nice.
Absolutely.